So our final speaker for the day is Nerida Croker. Nerida is an accredited pharmacist who has worked extensively with residential aged care facilities in medication management and clinical care of residents, and she has sat on medication advisory committees as well. She's also the CESPHN's Quality Improvement Officer in Digital Health and works with Meditrex, the leading provider of medication management services to residential aged care facilities in New South Wales. Today, she's going to be exploring how My Health Record can be of benefit to residential aged care facilities in providing clinical care for their residents. Please welcome Nerida.
So thank you, everyone, and thanks for staying on Saturday afternoon. As I was introduced, I'm working with CESPN as a Quality Improvement Officer in Digital Health. So just before I start, I'd like to acknowledge the traditional custodians and sovereign people of the Aboriginal land on which we meet today. I recognise their continuing connection to land, water and community, and pay my respects to elders past, present and emerging, and I extend that respect to Aboriginal people joining us today. So I actually think that's my second slide, sorry. Today I'm going to talk about My Health Record. It is focusing on aged care facilities, but I know a lot of you are clinicians working in aged care, whether you be GPs or allied health, and it will be applicable to everybody because this initiative is trying to get everybody on the same page, providing the same information to everybody, and a lot of what Daniela just said, and particularly around transition of care, is one of the areas this can really help. So as well as the Digital Health Agency is the system operator for My Health Record. So it's a federal government body. They managing the My Health Record program, and CESPN and other PHNs are working with them to provide this. So as part of my work at CESPN, I'm with the Digital Health Agency working group in My Health Record in residential aged care, and we're trying to really look at some of the barriers to uptake. How is it going to help clinicians? What's the problems? How do people access it within the facilities? And we're trying to feed back that information to make sure this is continually evolving. It's not a static program, the My Health Record. So why do older people or older Australians need a My Health Record? So this is mostly from the Pharmaceutical Society of Australia's Medicine Safety Report that came out this year. So they found that 11% of older people, when they get discharged from hospital, they're discharged into aged care. That might be as a new admission, either for respite or permanent care, or it might be that they're returning to their facility. But whatever the case, quite a lot of people are going from the hospital into aged care. And the transfer-related medication errors have been seen to happen somewhere between 13 to 31% of residents, which is pretty high. So, when those transitions of care occur, that's where we're mostly going to be at risk of some errors happening. And again, this is where the integration of our systems is really, really important, and perhaps it hasn't happened as well as it could in the past, but we're hoping that My Health Record will provide a new platform, I guess, to help some of that transition of care errors, for them to be reduced. And interestingly, the PSA found that 90% of residents in aged care facilities have at least one medication-related problem. A lot of that's probably going to be to do with polypharmacy or hyperpolypharmacy, and I don't know if there's a word for 10, 15, 20 medications. My greatest ever medication review was 33 medications. Obviously older people do have more health problems, they will have more medications, and they're more likely to have some kind of problem with those medications. And that's not an error necessarily, it's just talking about maybe they're not on the ideal treatment for their conditions, maybe the dose hasn't been adjusted for their renal function. There's a lot of different areas that can affect, but again, we're talking about a large proportion of people having some kind of issue with their medications. So the statistics for now, for My Health Record, this was from July this year, and they have found, so after the opt-out occurred in January, just over 90% of all Australians now have a My Health Record. I don't know if you all have one. You may have opted out. Maybe you forgot to opt out. If you didn't, you have one. So we're talking about a big proportion of Australians that have these electronic records. Now that we're into September, there's a lot more documentation flowing through, At the end of July, there was 28 million clinical documents in My Health Records already. 3 million, or just over 3 million, were shared health summaries uploaded by GPs. 4 million were discharge summaries uploaded by hospitals. 16 million, which is a lot, pathology records. So the pathology is going in there as well. So all of those are really relevant to residents in aged care, or just to older people generally. It doesn't have to be residents in aged care. And, so this information that's held there in these electronic records can be quite useful to people who are working in aged care. At the moment, there's 16,400 healthcare organisations registered. That includes everybody, GPs, pharmacies, hospitals, pathology providers, allied health. Basically anyone who is a registered healthcare professional can register as an organisation or as an individual. So again, likely that a lot of the GPs here today are already registered and already using this in your surgeries, but you can also access it in your laptop out at a facility if you need to. So that's quite important for you to know that. And this is continuing to grow. We're finding the momentum is really moving along. We're still getting a lot more registrations in CESPN, and I assume that's happening across Australia, that everybody's still becoming on board with this. If you're not familiar with what a My Health Record is, I'm not really going into that a lot today, but this is a broad overview. I think the most important thing to remember, it's just a summary of key health information. It's not every record ever for a person. It is a national system. So if you're going on holiday to Broome and you go to hospital in Broome, this record will be available there. If you have a new resident that's come from Queensland to come to be near family and they are now admitted into your facility, this information is available as well. So it is Australia-wide. It's accessible at all time, 24 hours a day. It's protected by legislation and also by the security mechanisms in place, and it's personally controlled, which we'll talk about a bit more in a bit. So again, when we're talking about polypharmacy and some of the, maybe the over-the-counter or the vitamins and supplements people might be taking, this is a new initiative that will be, I believe, piloted in October. This is called the Pharmacist Shared Medicine List. So the pharmacist can actually curate a full list now of all medication a person has taken and upload it into the My Health Record. Up until now, the only way that this information could be in a My Health Record was if a consumer added it themselves. So some people may have done. They might go in and go into their MyGov and then access their own My Health Record and put, yes, I take vitamin D and I take calcium, so I don't need that for my osteoporosis. But obviously not everyone would do that. So this is going to provide probably a more in-depth picture of what someone's taking. And again, it's just showing that they're trying to make improvements all the time for My Health Record. This is, feedback was, why can't this happen? And now it is going to happen. So it is continuing to evolve. Oops. In terms of the benefits, there's quite a lot, but I think that the main three are those top three. So it's not necessarily going to be something that you would need to access every day for your residents in aged care. If you have a person who's been residing at the facility for a long time, you're going to have their notes there. The GP knows them. They don't need to look at the My Health Record every time they come to visit. However, if you have a new person coming into the facility, whether that is on a respite admission or a permanent admission, it's very likely this would be a benefit. I'm sure everyone's familiar with when, someone's, their mum or their dad or their grandma, they're happily living up on the north coast or on the south coast in their retirement place, then maybe they're getting more frail, they've got dementia. The family member says, no, that's it, Mum, you've got to come and live closer to me. I'm going to get you a place in this lovely new aged care facility that's just up the road from my house. So they move in there, they've got to get a new GP, nobody knows them. They might turn up with their bag of medications or their Webster pack maybe, and potentially that's all they bring with them. There might not be any other information available for the GP that's taking on the care. And that's really hard. How can they know what's going on? Dr. Shell this morning had the list of medications for people with dementia. Some of them were things like sodium valproate or carbamazepine. If someone turns up and they're on that, how do you know if it's there for behaviour management in dementia, or if it's there for seizure control, or if it's there for neuropathic pain? You can't know without some other documentation. So the idea is that this is going to be available through a person's My Health Record. Similarly, even if they don't move a different city, even if they're coming just from Sydney, a lot of GPs won't go into aged care. They might say, no, sorry, I don't visit aged care. You have to get a new doctor anyway. So whatever happens, there's going to be that information available for the treating physician. The discharge, if they come out of hospital, will go in there. So again, if they get a new GP, they can access that hospital discharge. The transfers of care, again, back and forth to hospital, it's going to be very useful. Generally, anything that can make medication use safer, I think, is really important. And I use these in my RMMRs and my HMRs. I use the My Health Record. I look at it for people, and it will be available to anyone who's looking at someone's medication in the facility. We'll talk a little bit about the representatives more in a moment, and the same with the advanced care planning, but that's other benefits that you will see from a My Health Record. For the facilities, I know you've got your new standards that came into effect in July. So broadly, with the new standards, My Health Record can certainly help with Standard 2, which is around the assessment and planning, the advanced care planning. It can help with Standard 3, which is to do with clinical care. There's lots of parts of that standard it will apply to. Some of it's around referral to other professionals, providing best practice healthcare, and looking at the high risk situations for residents. And the other thing, of course, is the overarching standard of Standard 1, consumer choice and dignity. This can also assist with. Other benefits. When you're talking about older populations, you may be talking about people who are living with dementia. They might have had a stroke, they might have hearing problems, they might have potentially English as a second language, and all of those issues are going to make it quite hard for the consumer themselves, to articulate their healthcare needs to their providers. They may not be able to remember, they may not be able to discuss with their GP, why are they on these medications, what's going on. And I guess the other thing is maybe they don't want to. Maybe they're quite capable of telling you about their medication history, but maybe they're sick of talking about it. They don't want to talk about how many times they've been in hospital or what's going on with them, so they don't have to repeat the same thing over and over again. The whole idea is the more we can share this information and the more this is accessible by all treating clinicians, is the better the outcomes for the patient. Briefly, in terms of security, I know this is a concern for a number of people, and it was the reason some people opted out of the program. There are a lot of safeguards in place. There's strict encryption, there's firewalls, there's audits of who's logged on, when they've logged on. If it seems like it's unusual and some suddenly a GP looks like they're looking at records at 3 a.m, it's possible, but it's probably unlikely, so it would be flagged as, is this some sort of a hack? Is something going on here? It's monitored 24/7 from the Cybersecurity Centre within the Digital Health Agency. And there's really strict legislation around it as well. So there's a lot of kind of controls around the security. All the data is kept here in Australia. And the other way that this is controlled is about who has access to it. So if you wish to look at a person's My Health Record, you need to be working for a registered organisation. So an aged care facility would have to register. The GP surgery or the GP organisation may already be registered, so that's fine. Then the actual clinician who's going to look at it has to be registered as well. So it's only clinical staff that would access this. It's not going to be the receptionist at the GP surgery or the laundry or kitchen staff at the aged care facility. It's only going to be clinical staff involved in care of the patient. And then obviously they'll need the patient information as well. So you need to know Medicare number, date of birth. So it's not something that's broadly accessible. Yes, I'm a pharmacist. Yes, I am registered, but I can't look up any of your information today because I don't know your details. And also I would be fined, I think it's $360,000. But it is very secure. So I did say we'd briefly speak about the representatives, consumer representatives you can have attached to a My Health Record. So if a consumer wishes, they can have a nominated representative. Basically that would be if I said, okay, I want my husband to be able to access my health record, or an older person might say, oh yes, I'd like my daughter or my niece or a family member. to be able to look at it for me as well. It can be anybody. It doesn't have to be a family member. It can be your next door neighbour, it can be your friend. But that is when a person makes a choice and they nominate that representative. The person that is the nominated representative can look at a My Health record, but they don't have control. They can't delete the record or they can't change the access. But certainly family members may prefer this. They might say, oh good, I can see what medications, I can see pathology if they want to. They can see things for their family member that's in the My Health record. An authorised representative is a bit different. It's when a person is actually assigned to act on behalf of the consumer. So basically that would be, well, when you're a child, that's your parent. Until you're 14, your parent's allowed to be your authorised representative if the person has a legal guardian or an enduring power of attorney. So it is legal document. If you have a resident and their family member says, well, I've got power of attorney, I should be able to access this, they need to apply in writing to the Digital Health Agency. And then they have a little bit more control over it, so they can change access. They could delete the record if they decide, nope, don't want my mum to have one of these anymore. They could actually delete it. So just so you're aware that that is there. And again, this is coming down to consumer choice, consumer dignity, and the consumer and their family member or their person responsible, they really should have some ability to discuss their medication and be involved in their healthcare discussions with their clinicians, their treating clinicians. So this is quite useful for that. The other useful benefit for My Health Record is around advanced care directives. There is the ability to upload either an advanced care plan or advanced care directive, which has to be uploaded as a PDF, or you can put the details of the custodian into the My Health record. To be very honest with you, I suspect at the moment the custodian details are easier. The reason being, at the moment, only the consumer themselves can add this information. So it would mean that your older person needs to log on to MyGov, log on to their My Health record, and then upload the PDF if they're going to upload the document. Probably that's easier to just type in their daughter or their lawyer or whoever has the documentation. However, again, talking about things being, always evolving, there are a number of trials at the moment that are being undertaken across all different PHNs across the country with different aspects of My Health record. One of them is in Western Australia and around advanced care directives, and they are trialling clinicians being able to upload these documents. So the GPs and the hospitals are uploading into the My Health record, which possibly or probably, I believe that's probably going to be better. It's going to mean that's more easily accessible, that documentation will be there. And obviously aged care facilities, I think, do this really well. They often have this documentation available, but again, it comes down to that, how do we get it to the hospital? How do we get this information to who needs to have it in a timely manner? So the My Health record is one way we might be able to do that. This next slide just shows briefly what the My Health record looks like in the provider portal. Aged care facilities can register and can access through some of the software. iCare, LeCare, eCase at the moment can access it. There are some still teething issues with some of the conformance software. So to most facilities, I think it will be easiest to access it via provider portal view. And this is, again, if any of you are GPs and you're visiting aged care facilities, you can also use the provider portal yourself on your own laptop, and you could access a My Health record as well if you needed to. So this one is showing where the advanced care planning documentation is kept, but as you can see on there, there's clinical documents as well, medicine records and an overview of health records. So it's pretty easy to access information if you need to. I did do a case study, but I knew I'd run out of time and no one wants to stay late. So I think it's going to be with the documentation that you receive. So if you want to look at it, you can. Just a little case study about how would you look at some of these documents, how could they benefit in aged care. But basically, otherwise, that's the end of my presentation. So are there any questions at all about it? No? Thanks. So yeah, please, if anyone is interested in finding out more, any education, getting registered, anything at all, please come and see me. Contact me. Thank you.
I actually have a question.
Yeah, sure.
So, most of the problems are around confidentiality and security. So if a person were to get transferred to the hospital,
Yep.
the aged care facility, then who's got access to, like, who can actually see the My Health record? Is it that the entire hospital has been registered, or?
It would be any clinician within the hospital who is treating the patient would be able to access it, yes. That's under the legislation. So if you're a treating clinician, yeah, you could access it. Again, some of these flags, like if like, yeah, everyone's going, that's fine. If like, I don't know, if suddenly 50 people all looked at the same record, that would probably flag at that agency and say, why is everybody looking at the same record? You know, is it a breach of security, whatever? But no, really, again, it wouldn't be just any staff. It'd be treating staff. It wouldn't be, I don't know, I'm not sure what other staff there are in hospitals, but it wouldn't be like the admissions person or the yeah, but it would be anyone who would be able to log in through the system.